child's feelings are very real to them and their emotions should never be discounted. Caregivers can support and help children learn coping techniques for those emotions and feelings that are hard to deal with, like fear and anger. Caregivers need to get to know the child and learn what type of temperament they might have. Recognize that they might need to adapt interactions to accommodate that child's personality. Caregivers need to incorporate resiliency in children, as they need to be able to cope with their problems and comfort themselves. Children that are resilient look for resolutions to problems, understand cause and effect, and are easygoing and positive. There are several ways that teachers can promote resiliency in the classroom. First, get to know the children in your care as an individual, developmentally and culturally. Have the kind of classroom environment where children feel safe and that they belong. Consistent schedules with predictable routines are important so that children feel safe. Healthy and trusting relationships are key to a child's development. Teachers should model appropriate behavior for children. They should help children understand how their behavior affects others by explaining it to them when there is a problem. Let children know why the other child is upset and how they can make it better and what they can learn from that situation. Teachers can also use praise, but use effective praise that's used directly after the desirable behavior and describes what you are seeing. Also, by building a bond with families, it helps foster trust in children, allows for a closer relationship. Use assessment procedures also, like portfolios, so that families can see the child's development and become involved. In a toddler room, teachers can help children cope with their fears by acknowledging them, that their fears are real. Help support the children so that they find ways to cope with their fear. Try to prevent fearful situations from happening when possible, such as when a stranger comes, have them approach slowly, or inform the children that a firefighter is coming in and show them what they might look like in their uniform. If a child is scared about a special event, allow them to take a comforting object with them. Some children might need to adapt to new situations, so allow them the time that they need. Anger can be another issue for toddlers. Acknowledge that they have a feeling, label it so they know what it is, and show them acceptable ways to express their frustration, such as pounding clay, throwing beanbags. Some children might use self-calming techniques that are innate, such as thumb sucking or stroking a favorite blanket. But when caregivers accept children's feelings, create a safe environment for them to express those emotions, and teach them coping strategies, children will learn to deal with frustrations and learn to self-regulate. Caregivers may need to set aside their own feelings in order to understand what a child is feeling. However, if it's appropriate, you should express how you feel at times. Remember to provide for a toddler's needs to prevent some frustration. Remember that they need to be well fed, well rested, and that toys in the room should be in good shape and appropriate for their age in order to curtail some frustrations. Children also need to learn self-direction and self-regulation. Then they will be able to manage strong emotions in more socially acceptable ways. You can help young children foster self-direction by using words to describe their experiences, such as, "That was a loud noise," "That scared you." Also allow quiet time so children can focus on their experiences and emotions. Provide a secure environment with stable relationships where children are allowed to do what they need to do to move on developmentally. Be present, support the child, but also give them the freedom to explore. Supply reasonable limits, use redirection in a positive manner with them, and help them understand how others may feel. By providing responsive and respectful care to young children, it's the best way to support and ensure that a child will grow to their full potential.